So we're going to cover some of the main topics that people need to think through as they transition into retirement. So we're going to go through how much income that you might be able to realize from investments. The pension can be a component for some folks. So we're going to skip that today because that is more on a case-by-case basis, but Social Security definitely affects pretty much everybody. We'll talk taxes, health insurance, estate plan, and long-term care planning. So all of those things need to be really addressed as you're thinking about your own retirement plan. We're going to start with health insurance because this is the topic that really delays most people from starting their retirement, because they're thinking, well, gosh, what do I do up until age 65? That's when Medicare starts for most people, is at age 65. And so there's actually 6 different ways that you can provide insurance during that gap between retirement and Medicare starting at age 65. So for some folks, there may be some retiree health insurance benefits from their employer. But for everybody else, the remaining 5 options are really available to us. So COBRA, short-term health insurance, the health insurance marketplace, you may call that Obamacare, or the healthcare exchange. There are some plans that are not on the healthcare exchange. We'll take a quick peek at that today. And then something called health sharing plans, which I think are a pretty unique option that is a real viable option that many people should consider as well. So COBRA is pretty self-explanatory. Basically, it's an extension of your former employer's coverage. The quick tip here, COBRA can last up to 18 months. But in many cases, you might actually want to stop COBRA early. You may want to stop it on December 31st and then start your new coverage on January 1st of the following year. The reason for that is, let's say that your 18 months of COBRA goes partway through a calendar year. Well, you have a deductible for your health insurance through COBRA. And if that ends partway through the year, now you start a new policy for the second half of the year. And now you have a brand new deductible. So you can actually have 2 deductibles in the same year. And so for that reason, it may make sense to stop COBRA on December 31st and then start your new policy on January 1st so that you just have that 1 deductible per calendar year. Short-term health insurance is another option. This is typically, we're going to have to work through a health insurance agent to basically request a quote. As the name implies, it is short-term, 12 to 18 months. They can exclude for pre-existing conditions. There may be some other limitations there. So that one's really more on a case-by-case basis. I think where most people are going to end up is really in one of 2 areas, though. They're going to end up either in the health insurance marketplace, so healthcare.gov, or they're going to end up in a health sharing plan. And the reason for that is it just simply comes down to price. The plans that you can get through the health insurance marketplace, there are subsidies that are available for to help pay the premiums for those plans. And right now we're in a special period of time that through 2025, if your premium exceeds 8.5% of your adjusted gross income, you're going to receive a subsidy to make up for the difference. So in other words, nobody should be paying more than 8.5% of their income towards a health insurance premium. Now, even without that special rule through 2025, folks that do have lower income do qualify for a subsidy. Here's what I've seen, which is really interesting. Even wealthy people can qualify for the subsidy because the subsidy is based on income, not net worth. And so a perfect example of that is, let's say that you want $100,000 of income to spend for the year, and perhaps you have an investment that you paid $70,000 for, and it's grown and now is worth $100,000. Well, if you sell that investment, you have $100,000 in your bank account to spend, but it's only that $30,000 of gain that actually shows up for purposes of income for health insurance. So I see many times people actually qualify for the subsidy when they weren't expecting to. There are some plans that are not part of the healthcare exchange that does not qualify for the subsidy. So finder.healthcare.gov is a place to actually go and see those plans that are available. What I've seen in many years is that most of the plans that are on the exchange they're basically in both places. There aren't that many that are only off of the exchange. And finally, the last one is a health sharing plan. And this is something that a lot of people don't necessarily know about. These health sharing plans tend to be through some sort of faith-based association or organization. And the biggest advantage here is that the premiums, that monthly cost, is much lower in many cases than a typical health insurance policy. So what's the catch? Well, the catch is that these health sharing plans, they can exclude pre-existing conditions. So if you have that, probably health sharing plan may not be right for you. And they don't cover preventative care like health insurance does. So your annual exam, your flu shots, those would not be covered by a health sharing plan. You'd be paying out of pocket for those. What I've seen, though, is that even after you pay out of pocket for some of those routine preventative care items, is that this cost savings, that monthly cost savings in the premium, is still beneficial. And so, Christian Healthcare Ministries, Liberty Health Share, MediShare, these are three of the examples. These are nationwide organizations, and so they're worth checking into as an option, between retirement and age 65 when Medicare starts. Now, when Medicare starts, the decision making is not over. We still have to make some more decisions here. So Medicare itself is pretty complicated. There's a whole other session that's been recorded. I believe it's posted on the website that talks about Medicare specifically. So today we're just going to talk about the basics. So there's two paths to Medicare. There's original Medicare, which you get directly through the federal government, parts A and B. A is your hospital coverage. B kind of covers everything else. It's the lab work, the office visits, things like that. And then a number of years ago, we added a drug coverage part D plan as well. So that's original Medicare. You get A and B through the federal government. Part D, you would get through an insurance company. Now, original Medicare doesn't cover all costs. And so to make up for those expenses that are not covered by Medicare, you can purchase a Medigap, also known as a Medicare supplement policy. And that helps to fill in some of those gaps that Medicare doesn't cover. So that's original Medicare. Medicare Part C is what's known as Medicare Advantage. This is the second path to obtain Medicare coverage. Medicare Advantage plans you purchase through an insurance company. It may be a local HMO or PPO plan in your area, and it replaces parts A, B, usually D, and it can sometimes offer additional coverage for things like vision, dental, and some other benefits like health club dues and things like that. Now, Medicare Part B, whether it's through original Medicare or through Medicare Advantage, there is a cost to it. There is a premium that gets paid. The premium that is paid is actually based on your income from a couple of years ago. And so the higher your income, the more that you pay in your Medicare Part B premiums. Now, for folks that are in Medicare currently, their Medicare Part B premium this year is $164.90, unless the last tax return that they filed indicates that they have higher income. Well, the last tax return that was filed is from 2021 because we haven't filed for 2022 yet. So if your income for 2021 is over any of the amounts that you see in the chart, there's something called IRMA. It stands for an income-related monthly adjustment amount. It's an additional cost to your Medicare Part B premium, and it's based on the income that shows up on your 2021 tax return. All right, so we've got health insurance kind of figured out. So now we know that we can retire, but now we need to figure out how much income and expenses that we may have in retirement. So, there's a rule of thumb out there that says that, well, people usually spend about 80% of their pre-retirement income in retirement. And that's not quite the whole story. That 80% is really for folks that have some lower income during their career. What the research shows is that folks that have higher income during their career really don't need to replace 80% of their income. They really only need to replace maybe about half to 2/3 of their pre-retirement income. But really a better way to do it is to say, let's base how much you're going to spend in retirement based on how much you spent before retirement. Now we're going to have to make some adjustments there. Perhaps your mortgage is going to be paid off by the time that you retire, or you don't have to pay for your life insurance or disability insurance premiums anymore. So that reduces the amount of income that you'll need. But maybe we need to plan for long-term care insurance. We've got that health insurance cost before and after age 65. And so a little work with pen and paper to calculate what the amount is that you'd actually spend can be very worthwhile. Now, the other way to look at it is, let's make sure that your portfolio can provide enough income for you. So you may have heard of the 4% rule. That came out of an academic study from a number of years ago, and it basically said, depending on whether the financial markets do well, do poorly, I want to make sure that I don't run out of money in retirement. So what's the safe amount that I can withdraw from my portfolio and make sure that I don't run out of money? And the worst case scenario there was, well, if you only withdraw 4% of your portfolio, you'll be safe. And there's been some updates to that study since then, but it's still a pretty good starting spot. We're going to make some improvements on that today, though. But that's basically what the 4% rule is. So here's an example of that. Let's say you want to spend $100,000 per year. Perhaps that's $10,000 per month gross, or $120,000 per month per year gross in retirement. Maybe we have a few $1,000s coming in from Social Security. And so we need to make up the difference with $6,500 per month coming out of investments. Well, if we just do the math backwards here, $6,500 per month times 12 months, that's $78,000 per year that we need coming out of the portfolio. Well, divide that by the 4%, and lo and behold, we need a $1.95 million portfolio in order to generate that $6,500 per month from the investments. Now, let's take that one step further, though, because what we also know is that people's spending in retirement changes as they age. So when you're in your 60s, kind of those go-go years, spending tends to be a little higher. And as you age, it slows down until you get towards the later years of retirement, when some of those medical expenses start to pick back up. What you'll notice from this graph here, though, is that on an inflation-adjusted basis, the spending actually decreases over time, even though it's a net increase because of inflation. If we exclude inflation out of there, it's actually a net decrease over time. So let's apply what we know here, that there is this natural tendency of a decrease in spending during retirement, to see if we can enhance that 4% general safe withdrawal amount. So for most folks, what we see is on the right side here, if we plan on that decreasing 1, then 2, and then 1%, like that prior line graph shows, we could actually start with not a 4% initial withdrawal rate, but something closer to 5%, with the expectation that we'll naturally have that decrease in spending throughout retirement. We can enhance that one step further by taking into account what the market is doing and what the portfolio is doing. Because obviously, if the market is doing well and the portfolio is growing, well, we can spend more than we were planning on. And so that's where the concept of guardrails starts to come into play here. The reverse is also true, that if the market is not doing so well, and we're willing to make some adjustments in our spending, we can perhaps start with a higher spending amount, knowing that if things don't go according to plan with the investments, that we can tighten some things up as well. And so that's the idea with those guardrails. Now, Social Security is another component of that retirement income, and there's over 2,700 rules. Social Security is a pretty complicated animal when it comes down to it. Most people miss out on average $111,000 worth of benefits because they don't choose the optimal Social Security strategy. So we're going to go through some of the rules today, and you'll see that some of the differences that get made here. So one of the first things that you need to know is what is considered a full retirement age. Full retirement age depends on when you were born. So for most folks that are in their early 60s right now, it's age 67. And so you can start Social Security at any time between age 62 and age 70. But if you started early, there's going to be a reduction. And if you delay, there's going to be an increase. And so And so when you start Social Security, it does make a difference as to how much that you'll receive. Now, even if you weren't working, if you're married, you are entitled to a spousal benefit. So that spousal benefit, again, anywhere between from age 62 to age 70, and it can be up to half of what the working spouse's Social Security benefit is at full retirement age. So if you're both at full retirement age, the working spouse turns on their Social Security benefit. The spouse, even if they haven't worked a day in their life, can also receive a check worth up to half of what the working spouse's Social Security benefit is. You'll notice one major change here with the spousal benefit compared to the worker's benefit, and that's in the form of the delayed retirement credit. So after full retirement age, so most people that's age 67, if you delay to age 70, your Social Security increases 8% per year. However, for that spouse benefit, notice that there is no increase. There are no delayed retirement credits for waiting past full retirement age. Now, the spouse can't receive the spousal benefit unless the worker has turned on their Social Security. So depending on what your work history looks like between spouses, it may actually be advantageous for the working spouse to start their Social Security when the spouse is full retirement age, because then they can get the maximum benefit through that from the spousal benefit from Social Security. Now, here's the other little wrinkle with when to start Social Security. It comes down to survivor benefits here. And so here we have a couple, and we have a high income earner on the left side, a lower income earner, a lower Social Security benefit for the other spouse on the right side. Notice that at the first death, the surviving spouse keeps the higher of the two benefits, and that smaller benefit disappears at that point. And so many times it makes sense to try to delay the larger Social Security check as long as possible, because it's going to last for the longer of two lives rather than just one. Now, many folks don't have a Social Security statement these days. Unless you are old enough, Social Security stopped sending out the paper statements a number of years ago, but you can access it online. So we're going to go through how to actually get your Social Security numbers. Both the IRS and Social Security can use the same login. There's two different systems, but they both of them use the ID.me system for login credentials. So I suggest if you're going to access the Social Security benefits, you might as well use the ID.me credentials, because that works for the IRS as well. Once you have your credentials and log into Social Security, you can actually utilize the My Social Security Retirement Estimate, which you see on the screen there. This is where you can dig up and do a projection of your actual Social Security benefit amounts. So in this case, the way that I typically do this is it knows if you're still working, Social Security knows what your earnings history has been, and it'll forecast that going forward. But I like to run the estimate assuming that there is zero future income. And then you see also on the right side there, in this case, this is a married couple, so we included the spouse benefits as well. The reason I included zero future income is because then I can get both an estimate of what the Social Security will be if somebody continues to work to full retirement age. And that's what you see on the bottom here in this gray section. So here's age 67, full retirement benefit would be $3,300 a month. But by putting zero additional income in, I also get these estimates in green. And so this is essentially the Social Security that has been earned up to this point in time, assuming that I don't work another day, and then start claiming it at age 67. All right, so we've got our Social Security estimates. We know what kind of income we can generate from investments. Now we need to tackle what can be one of the most expensive parts of retirement, and that's if somebody becomes ill and needs some some help with long-term care expenses. Most people, most couples will experience some sort of long-term care expense at some point in time. Home modifications, it may be some services in the home, assisted living, nursing home are some examples there. And the costs do vary. So the costs on the screen, these are the average monthly costs in Wisconsin. And so depending on how much care is needed or the type of care, can be anywhere from a few $1,000s a year up to, for full-time nursing home care, up to and exceeding $100,000 per year. And so this is one of the biggest expenses that most retirees do face. Now, there's a few ways to pay for long-term care expenses. Many people think that Medicaid can pay. Well, Medicaid can pay, but only if you financially qualify. Medicaid is for low income, low asset folks that can't otherwise pay for their own nursing home care. Medicare will only pay for some nursing home care for the first 100 days, but you have to have a qualifying hospital stay first. So neither Medicaid nor Medicare are necessarily going to provide much, if any, benefit. So beyond that, you're either paying out of pocket, buying an insurance policy, or figuring out some other way to provide for care. Now, 15 years ago, long-term care insurance policies were a whole lot less expensive than they are today. And it was for everybody, if you were insurable, the right answer was to go out and get a long-term care policy, because that was the best, most cost-effective way to cover this potential expense for long-term care expenses. These days, the price of those long-term care policies has come up so much that it's a whole lot harder to justify whether it's worth buying a policy or not. And so this does come down to more of a case-by-case basis of whether or not insurance is the right answer or not. So finally, let's talk about taxes and estate documents. Taxes are fairly interesting in many cases for folks that retire. So here's an example of somebody that retires at age 65. What we're looking at here is ordinary income. And so you notice the blue chart at age 65, when their wages stop, that ordinary income drops off as well. But then we get out to either age 73 or age 75, and that's when required minimum distributions have to start. And so that's why you see that ordinary income, or that blue graph, jumps right back up again. And so for many folks, we have this opportunity to do some tax planning between retirement and before required minimum distributions start. So how much is that required minimum distribution? Well, thanks to the Secure Act that just got passed a couple of weeks ago, we have a change in when those required minimum distributions start. So a number of years ago, it was age 70 and a half. Then it was updated to age 72 as a starting age. Now, the earliest that you have to take required minimum distributions is age 73 if you were born before 1960. If you were born in 1960 or after, your first RMD age is going to be at age 75. How much you need to withdraw from those tax-deferred accounts is based on a factor, a life expectancy factor. And what I've placed on the right side here, this is the rough equivalent of the amount of the account that needs to be withdrawn per year. So it starts at roughly 4% of your tax-deferred account balance. So whether it's 401k, 403b, or IRA, it's roughly 4% of the prior year-end balance that needs to be withdrawn. So on a $2 million portfolio, in this case, it's about $75,000 a year, $3 million portfolio, about $113,000 a year. If we add that on to any other income, you can see how that can push you up into some higher tax brackets. And so what you have on the left side here, these are the federal income tax brackets. And then if you file married filing jointly versus married filing single, or excuse me, filing single, you can see how that income starts to add up. Social Security can be part of the income that's here, plus those RMDs, plus pension. You may have some dividend or interest income that contributes to this as well. So it's all inclusive in many cases. So what can we do? Well, if we take that same graph as before, and you notice those horizontal lines that go across the graph, those represent the income tax brackets. And so in this case, why don't we pay some taxes before we need to? So let's accelerate some income between retirement and before required minimum distributions start, so we can pay the taxes, but pay it at that lower tax rate. So we're basically going to fill up those lower tax brackets, and doing that by Roth conversion. So it's simply a transfer from tax deferred accounts into Roth accounts. It's a fancy transfer called a conversion, and we pay taxes on that money, but now it's sitting inside of a Roth account where it can never be taxed again. It grows tax-free inside of that Roth account. In this example, that tax savings is worth about $1.2 million in the lifetime benefit by doing those conversions. So finally, let's talk about estate documents. This is an important piece of the financial puzzle as well. And I'm going to be focusing on the documents that are typical in Wisconsin. Wisconsin is a community property state, or also known as a marital property state. So these are the typical Wisconsin documents that are part of an estate plan. So a will is used to transfer assets through the probate process, through the court process. Financial power of attorney, healthcare power of attorney. This allows somebody to make decisions for you while you're still alive. So these are life documents, not death documents. A trust is similar to a will in that it transfers assets to heirs, but it doesn't have to go through the probate process. And a trust can actually provide some legal protection around those assets, especially in the case of minors, or even for adults that leaving assets in trust for their benefit provides some protection as well. And then in Wisconsin, because Wisconsin is a marital property state, Wisconsin also has a marital property agreement. Now, Wisconsin stole a clause from the state of Washington called the Washington Will. So the marital property agreement is typically used as a cleanup document to sweep or transfer assets into the trust so that the trust can control the distribution as part of the estate plan. Now, not all assets will actually transfer by will or trust. So think about the any accounts that you have a joint owner on. Well, when one owner dies, if it's joint with right of survivorship, the other joint owner on that account simply takes 100% ownership. You may have beneficiaries designated on life insurance or on an investment account. And so it doesn't matter what your will or your trust says in that regard. Whoever the beneficiary is of those accounts, that's who receives that asset. So oftentimes what I'll see estate attorneys do is they'll create a trust to control the distribution of the assets. And then we update the beneficiary designation so that instead of making that person the beneficiary of that account, we'll actually make the trust the beneficiary of that account. And that way, the IRA, the 401k, the life insurance gets paid to the trust, and now the trust can control the distribution going out to the heirs. Another, depending on the type of an account, the other way to describe a beneficiary designation is transfer on death or payable on death. It's typically used with bank accounts or with real estate. And then finally, there's a term called per stirpes, and then basically this means that everything stays in the bloodline. So think of the case where you may want to leave everything to your kids, but if one of those children predeceases you, you want their share to go down the bloodline to your grandchildren through that child. And so that's what that per stirpes designation does, and that's used quite often in estate planning as well to make sure that that asset stays within the bloodline. And so today's been a quick overview of all those different topics to consider for retirement, whether it's health insurance, investment income, Social Security, long-term care, estate planning, taxes. So I hope this has been very helpful for you. Thank you for joining me today. Happy to stick around and answer any questions if you have any. Otherwise, please enjoy the rest of the day and the weekend. Thanks, everybody.